Well, along with the predisposing factor, it may lead to chronic sinusitis. What are these predisposing factors? Of course, a viral upper respiratory infection, dental infection, allergic rhinitis, and Alexander sinusitis, and gastroesophageal reflux disease. And of course, what will explain the object of our study is anatomic problems like septal deviation, like adenoid hypertrophy, conchabulosa, nasal polyps, and cleft palate. Also, systemic diseases like cystic fibrosis and primary ciliary dyskinesia may play a very important role in the pathogenesis of chronic sinusitis. The aims of our study is to evaluate the therapeutic role of septoplasty in children with chronic sinusitis and severe nasal deviation. For this purpose, we had 17 patients that were with a median age of 9.6 years that were eligible to undergo septoplasty. All patients had a history of chronic sinusitis, 15 unilateral and 2 bilateral, and did not suffer of any other medical problems that might predispose to the recurrence of the sinus disease. Decrease of airflow was confirmed preventative by means of rhinomanometry. 13 patients underwent closed septoplasty called technique, and 3 open rhinoplasty for correction of the septal deviation. The mean operative time was 47 minutes, no mortality or morbidity was reported, and all patients were discharged on the second postoperative day. At the first year follow-up, 16 of the 17 patients had satisfactory airflow on rhinomanometry, which means that we've checked the deviation. However, 12 patients remained sinusitis, only 12 patients remained sinusitis-free, and 3 of the 17 patients reported only 1 episode of acute sinusitis without chronic. And 2 showed no improvement in their condition. Here is an image of our rhinomanometry lab in Pentelli Hospital, and here is a pre-op and post-op photo. There was a patient that underwent open rhinoplasty with the well-known butterfly incision. I won't stay on that. You can see here the cartilage, and then that's the final. Now, we know that, as I said, chronic pediatric sinusitis, like other sinusitis, is a disease related to the dysfunction of the osteia, especially of the stomatal complex. The nasal septal deviation may compress the mesoturbinate, and thus may block the ostomatal complex, causing sinusitis. However, we know that nasal septal deviation is present in only 10.4% of the children with chronic rhinosinusitis, and there are many children with chronic rhinosinusitis without septal deviation, and many children with septal deviation and without sinusitis. That's why the role of septal deviation and other anatomic anomalies has been strongly debated, and we know that septoplasty in children cannot be applied widely like in adults because it may contribute to developmental problems in the future. However, symptomatic nasal obstruction and severe deviation are major indications for pediatric septoplasty. That's why what we can say for the role of neonatal septoplasty is that when we have chronic rhinosinusitis, all medical factors will be excluded or treated first. If we can perform FES, and we think that FES is more effective, of course we'll perform FES. And when we consider performing pediatric septoplasty,